Our group focused on central line-associated bloodstream infections, also known as CLABSI. Central line-associated bloodstream infections are among one of the most frequent complications arising in patients with central venous catheters. Infections such as CLABSI result in thousands of deaths each year, as well as billions of dollars in cost to the healthcare system. A central venous catheter can be placed in the neck, chest, or groin and is utilized for the administration of medications or the collection of blood. Numerous patients seen in the nursing field have central venous catheters placed in one of the previously mentioned locations. Therefore, CLABSI risk and prevention is very prevalent in current practice. The question we focused on here is, in patients with central venous catheters, does scrubbing the port of the central line after removing the disinfectant cap reduce rates of CLABSI during the time in which catheters are placed? In order to prevent CLABSI in our patients, nurses must practice proper hand hygiene before and after working with patients with central venous catheters. Nurses who specialize in the insertion of these catheters practice sterile techniques during the insertion, such as wearing sterile gloves, a sterile gown, cap, mask, and using sterile drapes. Following placement of central lines, nurses utilize proper maintenance practices, such as using a central line bundle, which includes hand hygiene, cleansing with chlorhexidine prior to accessing the line, assessing the integrity of the dressing, changing it every 7 days or before that if it is loose or soiled, and to assess the necessity of the central line daily and remove it promptly if it is no longer necessary. Should there be a change in practice? Wiping needleless connector ports with alcohol swabs following the removal of disinfectant caps will either reduce the rate of CLABSI or can cause contamination, which would increase the rate of CLABSI in patients with central venous catheters. This would need to involve a change made in the policy, procedure, and institutionally while caring for patients with central venous catheters. Our group is interested in risk management, identifying the clinical problem of CLABSI rates in hospitals, as well as the organizational standards. Currently, there is no policy or procedure stating the protocol for cleansing needleless port connectors on PICC lines. However, current practice involves the use of disinfectant caps on all needleless port connectors that are not in use on central venous catheters. Patients, infection control, and risk management would be interested in this research. While current practice is effective at lowering CLABSI rates, the use of alcohol swabs after removing the cap could either further reduce CLABSI rates or result in contamination of the port. If found to be effective, CLABSI rates would potentially decrease, and there would need to be a change in the policy and procedure of central venous catheter care. CLABSI is measured by signs and symptoms such as fever, reddened skin at the insertion site, and soreness. Intervening is measured by removing the central line. Outcomes are measured by blood tests and antibiotic usage. Measuring the effect of the proposed EVP change would be done by measuring the rates of CLABSI in patients with central venous catheters that have been scrubbed with alcohol after removing the disinfectant caps versus those that have not been scrubbed.
The next section of our project is the synthesize section. The current research on our topic, there's a limited amount of research on the use of alcohol wipes and Kuros caps when accessing the central line to decrease CLABSI when they're used in collaboration with each other. And the current research supports that Kuros caps are more effective than using just an alcohol wipe to prevent CLABSI. So the first study we have was a qualitative case study, and the title was Feeling Confident in Using PICC Lines, Patients' Experiences of Living with a PICC Line During Chemotherapy Treatment. So the purpose of this study was to discover the level of comfort patients have when using their own PICC, especially when on chemo, which is long-term treatment. So they'll be stuck with this PICC line for quite some time. It's relevant to nursing care because this article in particular highlights what the nurse can do to make the patient feel more comfortable when the nurse is caring for the PICC line. Not necessarily when they have the PICC line home, but when they come to the hospital to face complications and such forth. So the findings of the study, there were 3 major themes outlined in this research study. The first one was the importance of security. The second one was the importance of contentedness. And the third one was feeling confident in using the PICC line. Some patients needed motivation to want to care for the PICC line properly. Others saw that they wanted to get the PICC line out because they felt like having the PICC line out also signified that they were done with their treatment. Others were just content that they had the grind instead of getting repetitive venous stimulation. Nurses also need continuing education on how to properly care and maintain PICC lines patients. A lot of the people that were interviewed specifically said that they felt like nurses at the clinic didn't know as much as nurses at the hospital did for their PICC, like how to care for their PICC lines. So a lot of the patients said that they take the extra time to go to the hospital because they felt safer and they felt like the nurses had a higher level of competency when dealing with the PICC line. So the strengths of this study was that it was credible, and because it is a qualitative case study, a really big strength of the credibility and the study as a whole is that it is a scientific systematic analysis of the data, which makes it very credible. Some weaknesses is that the small sample size was only 10 participants, and only targeted cancer patients, and another weakness that the article stated was that further studies are needed to develop knowledge about PICC lines during chemo. Further areas to examine would be, like I just said, PICC lines and chemo, also a wider variety of patients outside of cancer patients. For example, maybe long-term care patients, or less serious patients, or maybe patients that just go home with their own PICC line and have possibly a DNA nurse visiting them. Study was easily feasible. All that we needed to do was to collect the patients and interview them. The benefits is that it provides the ability to understand the patient's point of view when caring for their PICC line. There were no risks. So the next study we had was a quantitative. The rest of the studies we had were quantitative. The title of this was The Efforts of a Unit Practice Council to Implement Practice Change Utilizing Alcohol Impregnated Port Protectors in a Burn ICU. The purpose of the study was to discover if the alcohol wipes or the Curos caps, which one is more effective to decrease CLABSI rates, not in collaboration but separately. So either the alcohol wipes, which was the pre-intervention period, and the Curos caps, which was the intervention. The findings were that the Curos caps decreased the CLABSI rates more than just the alcohol wipes. And this is relevant because it can move towards evidence-based practice showing that Curos caps are more effective than just filling the hub with an alcohol wipe when accessing a PICC line port. The strengths of this study is that it's credible. There was a strength that there was a high compliance rate from the nurses on the floor because the unit practice council was monitoring and auditing, so the nurses were more compliant with the Curos caps during the intervention period, which is a strength. And nurses were also given disinfection education every 3 months, which also helped with their compliance. Some weaknesses is that the patient population was very small, very specific in the burn ICU, and that the study was done over 3 years. And the article mentioned that there were many changes that occurred with the unit, such as they were relocated to another location. There was a high amount of staff turnover, and it also noted that when the staff was there was a huge turnover, and so there were a lot of new nurses on the floor, which also was related to increased CLABSI rates, so that also could have affected it. And there was a visit from the Joint Commission, which kind of skews how compliant nurses are in this case. Further areas to examine is the same as the last one, a wide variety of patients, because burn ICU patients is a very specific sample, and there's a ton of different med-surg, long-term care, tele patients, cardiac patients, critical care, other critical care patients, surgical critical care patients, medical critical care patients. There's a lot of different type of patients, even just within the hospital and outside at other facilities. This study was easily feasible. The only cost would be to purchase the Curos caps and to ensure there's compliance, which was done by the UPC and CLABSI. The benefits was that it was found that one method of the Curos caps is more effective than the alcohol wipes, which traditionally the alcohol wipes are used, so this can help the ball rolling on changing policy procedures also. And then over to this study. The third study we had was also quantitative. The title was Impact of Alcohol Impregnated Port Protectors and Uterus Pressure Connectors on Central Line Associated Bloodstream Infections and Contaminations of Blood Cultures in the Patient Oncology Unit. The purpose is using both alcohol wipes and Curos caps more effective in preventing CLABSI than just using alcohol central line. So this is combining both the alcohol cure caps versus just alcohol wipes. It was found that both the interventions and the use of alcohol wipes and cure caps is more effective than just using alcohol wipes. The relevance is that this can also snowball and lead towards changes in evidence-based practice, because further the use of alcohol wipes and cure caps with more studies like this move towards both. Strengths is that it had a really good control group and a sample size, and that's credible. But some weaknesses are the difference in number of central lines in the control versus sample group. The control had 472 and the sample had almost half. The article noted that there was an unblinded before-after observational design as a weakness, and the use of alcohol wipes would increase use of sample in this study. For the area to examine, again, wider patient population, only patient populations that this study was hematology, oncology, very specific again. The feasibility easily feasible, but again, extra costs on the extra alcohol wipes and cure caps. Benefits, the same as all the other ones, it can help move towards a more advanced evidence-based practice, which means patients as soon as possible and there were no risks in the study. The last study we looked at was quantitative, and it was kind of the same as one of the earlier ones. It's the impact of universal disinfection cap implementation on central lines associated with infections. So this one again is just another study looking at the difference between using the cure caps versus the alcohol wipes. The study also shows that the caps are more effective and that drastically decrease CLABSI as shown in the table below. Strengths is that it was effective in trauma-centered, so there's a high variety of patients all the way from neonatal to adult, which the other studies did not provide. It's credible. And the weaknesses were there was ongoing education, which may have influences to increase CLABSI use. There's student nursing plans and like the thing that was ongoing education. There were no really further, I didn't think of any further areas to examine because they had such a wide range of patients coming through. The only thing that could possibly be a further area to examine is a combination of them, but there's not a lot of things about the combination of cure and alcohol wipes. It's usually one versus the other. This was easily feasible, and the data shows that the caps are more effective than the alcohol wipes and no risk to the study. So to overview all of the studies that we have looked at, some proposed changes from those studies would be increases in education, use of cure caps over the alcohol wipes, but the combined use of the cure caps and the alcohol wipes is the best, most effective way to decrease CLABSI. So for this portion, we're going to talk about the design. Our plan would be to have nurses incorporate cleansing the needleless port connectors with alcohol swabs after removal of the Curos caps. This would be done on medical surgical units, and it would be to decrease the incidence of CLABSI. Our specific research design would be a quantitative randomized experimental design. One of our group will not receive the intervention of scrubbing the needleless port after removal of the cap. That's going to be the control group. Then the second group is going to receive the intervention of scrubbing the needleless port with the alcohol swab after removal of the cap, and that's going to be the experimental group. We're going to utilize a pre-post method to evaluate the effectiveness of the intervention. Resources necessary prior to implementation are going to be education and ongoing training for staff as needed. This is going to be crucial prior to implementation just to ensure that everybody gets training regarding what's going to be going on for the study. Current protocol versus current evidence-based practice. We would also provide Curos caps and alcohol swabs available to all floor nurses, charge nurses, nurse managers prior to the change. We're going to establish infection control nurse to oversee proper cleansing and demonstration of the cleansing of the needleless ports for the interventional group. And we would also make sure that we have floor nurses to implement the change, charge nurses, and floor managers just in case audits need to be done where necessary, the infection control nurse to observe, and a statistical analysis. Outcomes will be measured based on if CLABSI rates decrease with implementation of scrubbing the needleless port after removal of the cap. Ongoing assessments and audits